Hi everyone, it's Paul from Berwick Smile Dental Care. Uh, Back in March, the country was placed on lockdown and dental services were suspended. We fully acknowledge that you will be eager to come back into the practice for your continued care. However, as you would have seen from the announcement just over a week ago, from the 8th of June, dental practices will reopen. Though this may not be immediately, as there are many policies to implement and patients will be triaged before being seen as per practice updates in the past. And yet, for those waiting for hygiene services, we are working hard to have you back with us as soon as it's safe to do so for both patients and for staff members. But what I would like to discuss with you is the changes that will be in place when you return. There's a restriction placed upon the use of equipment generating aerosols. This is classified as a high-risk procedure and includes the ultrasonic scalers. To date, we do not know when this level of risk will be changed, but in order to commence hygiene services, we can operate within guidance and offer a low-risk alternative. Our aim has always been and always will be to prevent and manage disease. Most of my focus has been on home care management, and this will not change. However, the structure of the appointment will. So no amount of scaling is going to, without changing a patient's understanding towards oral hygiene, solve the disease. There's no reason behind continually removing calculus if my patient is unable to manage the plaque at home to prevent the build-up to start with. We become locked in a continuous cycle with patients never improving, which I hope you all agree. I want your mouth to be as healthy as possible. And an excellent quote is, the most important factor in the prevention and treatment of periodontal disease is the individual standard of daily self-performed oral hygiene. Now what this means is your treatment of your disease will take place in your bathroom and not the dental surgery. Just because I need to be able to guide you and support you to make the right choices to aim for an optimum level of oral hygiene. If I remove all the nasty bacteria inside the mouth and the patient does not perform the effective home care management, the bacteria will regrow, and in the time between visits, what damage would have occurred? So the changes are, number one, we will still screen and diagnose. I will still screen for disease in your mouth, because if I don't diagnose, how can we effectively manage your mouth? However, alongside this, I will be giving every patient a bleeding score. Now, most of my patients will have had a bleeding score, some maybe not. However, this will change so that all patients receive a bleeding score. And it's a simple score that gives you a percentage out of 100% of surfaces within your mouth which are bleeding. It will be taken at every visit and compared to previous visits to give a snapshot of your efforts at home. As you can imagine, the higher the bleeding, the more inflammation. And it is this inflammation which can lead on to gum problems. Therefore, if we lower this percentage, then we are able to promote and basically promote stability and longevity towards your oral health. And after this, we're going to discuss further options if needed, based on your screening, just so you're fully aware what's inside your mouth, and treatment plan going forward if needs be. Thirdly, we're going to deliver the oral hygiene. There's no point in me giving you the information about bleeding gums or possible disease if I'm not able to teach the techniques to control this and stop this. However, and at this point, I will go through incidental cleaning and toothbrush demonstration, etc. Fourthly, we will then instrument the area, and this is a big change because I will be using hand instruments only on the affected sites, using the bleeding score as a guide. So basically target the bleeding scores first because they are the active sites because they're bleeding, and then following this, I'll then turn my attention to removing any visible deposits to help facilitate effective oral hygiene. Now, recently polishing devices have been allowed because at one point they said no to polishing. But in order to reduce splatter and cross-infection, if a patient presents with a lot of bleeding, unfortunately, I'm unable to polish the teeth because we don't want excess splatter with blood around the surgery. So we fully appreciate this is a different experience, or it will be a different experience from the norm. However, I must stress that the clinical result is the same. It just takes me a bit longer with hand instruments compared to powered ones respectively, as you could imagine. So please bear with us during these changes, but what remains the same, if not more important than ever, is your care and health. Now, from everyone at the practice, we wish you well and hope to get you back to the practice very soon. But any concerns, please do contact us.